Hello, my name is Dr. Dewan S. Raja. Today I will discuss about osteology of the ulna. The ulna is a long bone of the forearm placed on the medial side of the radius. It is a long bone, it is two end, upper end, lower end, and a shaft. This is the medial bone of the forearm. This is the post-axial bone. We'll go through the anatomical position and side determination. Upper end has the olecranon process and the cornoid process, and the trochlear and radial notches. The trochlear notch is concave forward. The interosseous border is sharp. The interosseous border is sharp and is directed laterally. Radial notch here in the upper end is directed laterally. Lower end is small, has a small rounded head. The styloid process of the ulna projects downward from the posterior-medial aspect of the head. So let's make it big now. Okay. So this is the trochlear notch. This is the radial notch. This is laterally. This is the interosseous border. Olecranon process is the cornoid process. Just under lower part we'll get the ulnar tuberosity. Okay, this is the radial notch. You'll get the supinator crest here. Okay, here's the interosseous border, and we'll get the anterior border here, and we'll get subcutaneous posterior border. Okay, in lower part we have the head, and from the posterior medial aspect of the head we have the styloid process. So this is the ulna of the left side. Okay, because we are seeing the posterior medial aspect, we'll get the styloid process and radial notch on the lateral aspect. Interosseous border is on the lateral side. We got the side determination and anatomic position. Okay, let's go to the next slide now. Okay, here again the cornoid process is here. This is the cornoid process, trochlear notch, olecranon process here, radial notch, tuberosity of the ulna. Okay, we have the anterior surface. This is the nutrient foramen. Nutrient foramen usually is a branch of the ulnar artery, and its direction is towards the elbow, upper part. So the lower end is the growing end in ulna. Okay, we got that. So here is the ulnar styloid process. Okay, and here is the attachment of the articular disc of the radioulnar joint. Okay, inferior radioulnar joint. Radial notch, we'll get the attachment of the annular ligament here. Okay, this is the trochlea. Trochlea is articulated to that of the trochlea, to the trochlea of the humerus. Okay, so it goes up to this level extension. This part go to the olecranon fossa here. This is the olecranon fossa. So this is that. This is the movement of the elbow joint, and ulna forms a part of the humero-ulnar component of the elbow joint. Okay, we got that. This olecranon process will go to the olecranon fossa in full extension of the forearm of the elbow joint. Okay, so we got the structure here, roughened upper part of the olecranon process for the insertion of the triceps brachii muscle. coronary process will get the insertion of the brachialis muscle, supinator crest for the origin, one of the origin of the supinator muscle. Okay, we'll go that. Here, the shaft has three surfaces. What are the borders? We have the sharp interosseous border, we just discussed that. This is the interosseous border here. Okay, interosseous border. We have the anterior border. Here is the anterior border. Okay, anterior border, and here is the posterior border. Posterior border, and three surfaces, anterior surface between the interosseous border and the anterior border. This is the anterior surface. Medial surface between the anterior border and the posterior border, the medial surface here. Okay, posterior surface between the posterior border and the interosseous border. So we got three surfaces of the shaft of the ulna. Olecranon possesses multiple surfaces with the superior surface, the lateral surface, medial surface, anterior surface, like coronary processes upper surface, that is the lower part of the trochlear fossa. Okay, and it has the lateral medial surface of the coronary process. So Olecranon process has multiple surfaces like that. Also the coronary process has also surfaces like superior surface, anterior surface, lateral surface, medial surface. Okay. Upper on the ulna, we have the olecranon process, coronary process, ulnar tuberosity. Ulnar tuberosity is located in the lower part of the coronary process, rough area of the coronary process. Lower part is the ulnar tuberosity. Radial notch is here for the attachment on each side for the capsular ligament of the superior radio-ulnar joint. Okay, there's a depressed area, shallow, smooth, oval. There's a depressed area below the radial notch to accommodate the radial tuberosity. Supinator crest is a sharp ridge below and behind the radial notch. Okay, the coronary process projects anteriorly below the olecranon process. Lower part of the coronary process from the ulnar tuberosity we just discussed. Shaft of the ulna has three border and three surfaces. Okay. Muscular attachment is important to us. Okay, let's start. Triceps brachii insertion, where at the top of the olecranon process, just posterior part of the superior surface of the olecranon process. Okay, that is the area for the triceps brachii muscle, nerve supply, radial nerve, brachialis muscle here from the coronary process as well as the ulnar tuberosity. Nerve supply, this is the insertion here. Nerve supply, dual innervation, musculogluteus nerve as well as radial nerve. Okay, supinator muscle from the supinator crest of the ulna. Here is the supinator crest of the ulna. Just from the posterior part of the radial notch, you will get the supinator crest of the ulna. Nerve supply by the supinator muscle, nerve supply by the posterior interosseous nerve or deep ulnar nerve. Okay, I mean the deep radial nerve or the posterior interosseous nerve, not the ulnar nerve. Okay, we got the supinator by the posterior interosseous nerve. Okay, there is a continuation of the deep radial nerve. Okay, flexor digitorum superficialis muscle origin from the tubercle on the coronary process here. Medial part here will get. This is multiple origin. One of the origin is here. Okay, that is innervated by the median nerve. Pronotor teres just below that will get origin, nerve supply, multiple origin. It is also origin from the common flexor origin, also from the medial supracondylar ridge of the humerus. Okay, Flexor carpi ulnaris also takes origin along with the extensor carpi ulnaris from the posterior border. Okay, and its nerve supply is from the ulna. Extensor carpi ulnaris nerve supply is from the posterior interosseous nerve, and coneus is a weak extensor. Okay, it inserts to the lateral aspect of the olecranon process and upper part of the radius. Okay, coming from the lateral epicondyle lower part. It is a weak extensor nerve supply and coneus by the radial. Then these three muscles, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, not brevis, extensor indicis, all of them originate from the interosseous membrane and from the posterior surface. Okay. So extensor muscle, so they should be getting innervation from the posterior interosseous nerve, including the abductor pollicis longus. Okay, so just we compare the insertion to the coronal process brachialis. Here on the medial border, we'll get the insertion of the flexor digitorum superficialis, the pronator teres, and we'll get here flexor digitorum profundus for the anterior surface, medial surface, from the anterior surface, from the medial surface, and also from the posterior border we'll get the origin of flexor digitorum profundus. And here is the origin of pronator quadratus from the ulna going to the radius. Okay, we got that. If you go to the posterior aspect of the ulna, you get the top insertion of triceps brachii muscle. This is the insertion of the anconeus muscle. Okay, and we'll get the origin of flexor carpi ulnaris and the extensor carpi ulnaris from a common aponeurosis along with the flexor digitorum profundus. Okay, so there is a common aponeurosis for the posterior border. So all the three muscle takes origin from there, and from the posterior surface along with the interosseous membrane, origin of the, here is the abductor pollicis longus, extensor pollicis longus, extensor indicis. This is the interosseous membrane. There is a gap in the lower part for the passage of the anterior interosseous artery. Here is a gap for the passage of the posterior interosseous artery. Anterior and posterior interosseous artery are branches of the common interosseous artery. Common interosseous artery is a branch of the ulnar artery. Ulnar artery is a bigger terminal branch of the brachial artery. Okay, we got that. So we got all the muscles here. So we have some insertion, triceps, and coneus insertion of the brachialis. We have the other muscle origin like that of the tubercle flexor digitorum superficialis, the pronator teres. Okay, and this is the flexor digitorum profundus, extensive origin from multiple bone and also from interosseous membrane. Okay, so flexor digitorum profundus here, and here is the flexor digitorum profundus. Then we'll get the pronator quadratus origin here. Here three muscle origin. One is the abductor pollicis longus, extensor pollicis longus, extensor indicis. Okay, we got the muscle origin. Now we'll go to the oblique cord. This is the oblique cord that extends from the ulnar tuberosity going to the lower part of the radial tuberosity. Its function is not very much known. It is dubious function it has, and it may be absent. If it is present, it passes over the deep fibers of the supinator muscle. Okay, again we are looking at that. This is the muscle. What is that muscle? Flexor carpi ulnaris, nerve supply by the ulnar nerve. Here is the flexor digitorum superficialis muscle. Okay, and we'll get the flexor digitorum profundus underneath it, flexor digitorum profundus muscle here. Okay, so multiple muscle are attached to the ulna. Okay, here is the pronator quadratus, originate from the ulna, inserting to the radius on the anterior aspect, lower and deep muscle. Okay, we got that. Okay, so here three muscle: abductor pollicis longus, extensor pollicis longus, extensor indicis, coming from the posterior surface along with the interosseous border. Okay, going to the digits. Okay, we got that. And this is the muscle. Here is the anconeus, from the lateral epicondyle to the olecranon process, lateral side, as well as upper part of the ulna. Is a weak extensor, innervated by the radial nerve. Okay, so other attachment, interosseous membrane, oblique cord, we discussed that. Capsular ligament of the elbow joint, ulnar collateral ligament of the elbow joint. Okay, ulnar collateral ligament of the elbow joint. Here we have ulnar collateral ligament of the, here is the ulnar collateral ligament of the elbow joint. Okay, we can write it here, elbow. Okay, so annular ligament of the superior radial nerve joint, that is attached by the side of the radial notch, and ulnar collateral ligament of the wrist is comparatively smaller than the radial than that of the elbow joint. The wrist ulnar collateral ligament is comparatively smaller. We have also articular disc of the inferior radioulnar joint. So we have elbow joint, hinge variety of synovial joint between the, a part of it formed by the ulna and the humerus, humerulnar part. We have the superior radioulnar joint, inferior radioulnar joint. These are the pivot type of synovial joint. We have also the wrist joint that is not contributed by the ulna, but that is contributed by the radius. Okay, we got that. Now go to the, here we look at the some of the ligaments and fibrous tissue. Here is the ulnar collateral ligament of the elbow joint. Okay, here is the annular ligament for the around the head of the radius and attached to the radial notch of the ulna. Okay, we got that. Now we got, this is the joint capsule. The joint capsule is attached along the margin of the trochlear notch area. Okay, we got that. Now this is radius, this is ulna. Okay, here is the interosseous membrane. We know that here is a passage for, here is the passage for the anterior interosseous artery, passage for the posterior interosseous artery. This is the oblique cord. The function is not well known. Okay, we got that. This is the tuberosity of the ulna, cornoid process for the insertion of the brachialis muscle. Here in the wrist joint, we have the collateral ligament of the ulna for the wrist joint. Okay, here also dorsal radio ulnar ligament. We have also the palmar radio ulnar ligament. Okay, on the other side. Okay, we got that. This is the palmar radio ulnar ligament. Okay. This is the styloid process of the ulna. This is Newton foramen. It is directed towards the elbow joint. Newton foramen, usually a branch of the ulnar artery. Okay. Ossification, we have 4 center of ossification, 1 primary center and 3 secondary center. Primary center for the shaft arises at 8 weeks of intrauterine life, 1 secondary center for the distal, and 2 secondary center for the olecranon. Remember that we have 4 center of ossification, one primary, three secondary. They will unite at different stages of the life. Okay, but it depends on the sex and nutritional status of a person. Okay, we got that. Now we go to the some of the clinical anatomy. Our radius and ulna work together, and we may have fracture of the radius and ulna both, or just one. Another one will be dislocated, so or it may not be dislocated. In Colles fracture, just the fracture of the radius. Galeazzi fracture, fracture of the distal third of the radius, associated with subluxation of the head of the ulna at the wrist joint. Montigia's fracture, fracture of the proximal third of the ulna, and then anterior dislocation of the head of the radius at the elbow joint. Okay, so that's all about the anatomy of the ulna. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice and blessed day. Bye now.